Hi Jane,
Hi, Joe.
nice to see you. Now, I understand that you've come to see me today because you were recently diagnosed with type 2 diabetes.
That's right, yeah.
Is that a surprise to you?
Bit of a shock.
You didn't suspect that you may have diabetes?
You wonder about it, but just finding out is different from thinking about
Do you
it,
have
isn't it?
diabetes in your family?
No, not really. I think I've got an aunt of mine who's got it, but no, otherwise
Okay.
nobody else really.
Okay. Well, before we talk about diabetes itself, I'll just explain how we've come to the diagnosis of diabetes, just so you understand about that. These days, we diagnose type 2 diabetes with a blood test.
Mm-hmm.
We used to do it with a fasting blood sugar level,
Okay.
by where we took a blood test in the early morning
Yeah.
after fasting the night before, and if that blood glucose level was raised, we could then diagnose it through the raised fasting blood sugar level. We do it a little bit differently these days. We use a test called an HbA1c.
Uh-huh.
Now, what that is, it's a measure of the amount of glucose or sugar contained in red blood cells in the body.
Okay.
Now, the red blood cells in your body have a life of about 3 months. So during that time, they collect sugar,
Mm-hmm.
and we can measure the amount of sugar that the red blood cell is collecting.
Mm-hmm.
So what we get in effect is a 3-month average of your sugar control. So it gives us an idea of what your blood glucose levels have been like for the previous 3 months. Now we know for people who don't have diabetes, their result should be below 46.
Okay, 46.
Most of the time it's below 40 if you don't have diabetes. If, however, it's above 46, we start getting a little bit more concerned.
Mm-hmm.
If it's above 48, we generally can diagnose you as having diabetes.
Right.
Your blood test was 70.
Right.
So clearly it's much higher than the normal levels, and therefore from that we can tell you that your blood sugar levels are raised, and that's really is what diabetes is. Diabetes basically means raised blood sugar levels. We all have sugar in our blood, but that blood glucose level is normally well controlled, and that's very important that it's well controlled. In
So
your
have I
case,
got a risk then? It's 70. That's a heck of a lot more, isn't it?
it is raised. It's not desperately high, but it's certainly raised, and that certainly does give you a risk. Because you may say, well, why is it a concern that you have a raised blood glucose level? Why should that bother me? Well, the reason for that is when your blood glucose levels go above the normal range, it can lead to some quite serious complications. High blood glucose levels in the body creates really a vascular disease in the body. It can start attacking blood vessels, particularly sensitive of the blood vessels in the backs of the eyes or in the kidneys. But it also can, in time, increase your risk of things like strokes and heart attacks, and also poor circulation into your legs and feet, and it can cause damage to these areas. So it's very important that when we diagnose people with diabetes, that we try and help you get the best level of control you can to try and reduce the risk of complications. Now, complications don't happen overnight. You're not going to suddenly have bad eyes or bad kidneys. These are things that tend to happen over time. So we're talking about 5, 10, 15, 20 years down the line
Okay.
that we see the complications. But of course, it's very important that we get the diabetes controlled very early on, because that way you're less likely to have the complications later on in life. And at your age, you're just 42 now. It's important that we get on top of it quickly. Okay. So how do you manage diabetes then? How do you manage this condition called diabetes? Well, from your point of view, the first thing we're going to do is we're going to refer you to an education session, because it's important. We've got the short time here now, but there's quite a lot to learn about diabetes, and it's important that you understand as much as you can about the condition, because the more you understand, the more you're going to be able to look after yourselves, because this is a condition that you are going to be looking after yourself. It's not something that I or anybody else in the family are going to be looking after. You're going to have to do this just for yourself. So the more you understand about your diabetes, the better position you're in to be looking after yourself appropriately. And of course, the main way that we manage diabetes is with lifestyle. And by lifestyle we mean diet and exercise primarily. So when you go to the education session, there'll be a big focus on things like food, diet, exercise, as well as explaining a little bit more about medication, for example, and about how to look after control and monitoring these sorts of things. So we refer you to an education session which takes place in Warsaw, at a local centre, and you'll get an appointment to come through to that. But before we do that, I think we can quickly go through some of the basics in the shorter term. as I said, your blood glucose levels influenced very much by the food that you eat.
Okay.
And I can see from your weight today that you are a little bit overweight, probably maybe a stone and a half overweight. And again, that has a big impact on diabetes. You won't be surprised to know that the vast majority of people with type 2 diabetes are going to be overweight.